Hi, my name is Mustafa Javed, and I'm one of the consultant orthopedic trauma and sports surgeons. My practice includes joint replacement surgery, fracture management, and minimally invasive treatment for sports injuries. So I decided to become a doctor because I've come from a family of doctors. My mom and my aunts were doctors. I think as a child, I wanted to be a fighter pilot. I think those were the original Top Gun days. But as I grew older, I realized that it was gratifying to help people in the field of medicine. And I thought if I could get into medicine and become a doctor, I had a chance to touch more people's lives as a doctor as compared to other professions. Why did I choose orthopedics? Well, medical school is about 5 years, and the first 2 years you gain knowledge in the classroom. It's the third year onwards where you rotate through specialties in the hospital, and that's generally the time most people decide as to what specialty they want to be in. I knew I wanted to be into something which was hands-on, something procedure-based or surgery. And when I did my rotation as a medical student in orthopedics, I realized that it's not just a specialty, but the specialty in itself had camaraderie. Everybody was like a big family and they all got along. And I think it matched my personality because it was all about getting things done. If it was a task, given to me like a sore arm or a broken leg, I needed to end up dealing with it, and there was immediate gratification. And I think that's one of the reasons why I ended up choosing orthopedics. Yeah, I think what I find most rewarding about my job is the fact that I've got the chance to able to make people comfortable. So if they come with injury or arthritis or wear and tear of a joint, we as orthopedic surgeons are able to help our patients reducing their pain. And when they're painless or hopefully pain-free, you end up having immediate gratification. And I think that's probably the most rewarding part of my job. The challenges in my specialization is everything that we deal with, which could be complex, like a complex fracture or a complex worn out joint. It's almost like putting pieces of a puzzle together. It requires a lot of planning in advance. It means liaising with other specialties, including physicians, physiotherapists, radiologists, and we, with time, I've noted that putting the pieces of the puzzle is only the part of the problem, because the other specialties help us getting the patients to recover and get back to their routine before the injury or before that pain had stopped them from doing what they did. So I think that is the biggest challenge that I find with my specialization.